Dear followers of Oko in Focus, good morning, good afternoon, good evening. We are thrilled to be coming to you live this moment from the Baptist Center in Bamenda, the chief town of the northwest region of the Republic of Cameroon. And as our tradition demands, we move around to get you informed, educated, and entertained, especially on issues that concern growth, progress, and living together as Oko people, as people from the Northwest, as Cameroonians, and as people of the world at large. We are fortunate today to be meeting an illustrious son of the soil. We are talking of no other person but the Director of Health Services for the CBC. We posted him on this platform some months back, and today he accepted to be our guest on OIF. You're welcome to OIF, sir.
Thank you very much, Open Focus.
We want to say Happy New Year.
Thank you. Happy New Year to you.
It's a pleasure to have you on the platform.
The pleasure is shared.
For the first time.
Obviously. Thank you very much.
I hope we are going to have a fruitful discussion.
Of course, yes.
And somebody out there will be blessed.
Always, because we are out so that our communities can develop.
Thank you. Right. We would like to know from you briefly who you are and the position you hold in the CBC.
Okay. I'm called Samuel Gum. I'm the director of the Cameroon Baptist Convention Health Services. Before being the director of the Cameroon Baptist Convention Health Services, I've worked for the Cameroon Baptist Convention Health Services for about 20 years. Yes, so I pull along about 23 years of experience in healthcare and healthcare delivery.
Okay. Thank you so much. Yeah. I think that is quite a good number of years. 20 years, 23 years, 30 years, that is much. We are going to be talking about community engagement amidst other things. Yes. How important is community engagement in improving public health?
Yeah, in the first place, you know, when Jesus Christ came to earth, he came so that we can have life and have it to its fullness. We can always read that in John 10, verse 10. And as a healthcare organization, which we are, we want to promote holistic care, which is a sacred expression of faith and central calling of the church. Yes, so that is the first thing that we are out for as CBC Health Services and as an organization, as a church. And with community engagement, actually, we know that our healthcare emanates from our communities because there is no population health without the engagement of the local population. Yes, you don't stand from a distance and then provide healthcare for people when they themselves have not identified what their problem is.
Exactly.
And when they are not engaged. Yes, when the people are engaged, it becomes holistic in nature. Everybody gets involved and then the population gets better health.
Thank you.
And that is how we look at engagement in all our different facilities. And just to come again to give you a brief history of how the CBC Health Services has developed over times in terms of community engagement. Most of our health facilities came from primary health centers. And these primary health centers were led by the communities. They were led by community leaders. They were led by community actors. They were led by champions in the community, reason for which you can always see this primary health care very close to the people. And everyone gets involved, everyone gets engaged. And most of our facilities grew from primary health center to to hospitals in that level. And everyone gets involved so that, because healthcare is not CBC Health Services. We bring the expertise. The community brings the other part of it.
Exactly.
Yes, because in going to the community to tell women, you need to vaccinate children, you need to do this, you need to eat better, you need to have better nutrition for health, it is not only us. It is a whole big package of everyone being involved.
Thank you. You made mention of the community.
Yes.
And we all know that every hospital is found in a community.
Yes.
And in all of these communities, we have community leaders.
Yes.
And we have households.
Yes.
What role can community leaders and households play in promoting these programs you are talking about?
You know, when we talk of universal health coverage, we actually talk of promotive health.
Yes.
we talk of preventive health, we talk of rehabilitative health, and we talk of curative health. So it's a whole line of different health, and
Exactly.
at every level, there are a cluster or group of people that are involved. When you have community leaders, their main purpose is on health promotion.
Exactly.
Yes, we bring the education, we bring the expertise of education, and the community leaders are the ones to take up that mantle of health promotion in the communities. And I just want to bring us back into the era when public health was just being established.
Exactly.
We had the movements in the UK for public health, which we call the sanitary movements, which it was embraced in our communities before. For people who were born in the 50s, 60s, 70s, and even early 80s will understand what I am talking about in terms of sanitary movement.
Exactly.
In our different communities,
I was not born by then, but I heard something like that.
You heard of it?
My parents used to talk of sanitary.
Yes, sanitation, and that was a sanitary movement, and that is preventive health. That's preventive health. You prevent diseases before they ever occur. And with that, there were a lot of environmental cleanliness. There was a lot of maybe construction of toilets, how they should be done, so that people can live healthily. We know very well that most of our disease, especially the infectious disease, come from our environment. How we live, what we drink, what we eat, how we move about, what the dust in the environment, and so on. So we had that movement. And many times there were the community leaders that were involved in that. We call this primary health care. We cannot drift from it. That is where health starts from, before we move into the sophisticated hospitals, doctors, equipment, whoever specialized, but that is where healthcare begins.
Exactly.
And we have to move from there. And we can never undermine or underestimate what has been there from the back in terms of this sanitary movement that was there. Is something to continue to promote in our community. We quickly have what we call, how do you call it? We call it, when people come out to clean, they call campaigns.
Yes, campaigns.
Yes, and so on. That is a form of promoting health
exactly.
in our communities that has been embraced by the wider community.
Thank you so much. As the Director of Health Services,